This training will provide you with information about the common serious mental illnesses and co-occurring disorders. Please understand this is introductory and general information. There is much more detailed information available. The information for today's training was obtained from the National Alliance on Mental Illness. You may visit their website at www.nami, that's NAMI.org. Mental illnesses are medical conditions that disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Serious mental illnesses include major depression, schizophrenia, bipolar disorder, obsessive-compulsive disorder, panic disorder, post-traumatic stress disorder, and borderline personality disorder. The good news about mental illness is that recovery is possible. Mental illnesses can affect persons of any age, race, religion, or income. Mental illnesses are not the result of personal weakness, lack of character, or poor upbringing. Mental illnesses are treatable. Most people diagnosed with a serious mental illness can experience relief from their symptoms by actively participating in an individual treatment plan. In addition to medication treatment, psychosocial treatments such as cognitive behavioral therapy, interpersonal therapy, peer support groups, and other community services can also be components of a treatment plan that assists with recovery. The availability of transportation, diet, exercise, sleep, friends, and meaningful paid or volunteer activities contribute to overall health and wellness, including mental illness recovery. Here are some important facts about mental illness and recovery. First, mental illnesses are serious medical illnesses. They cannot be overcome through willpower and are not related to a person's character or intelligence. Mental illness falls along a continuum of severity. Even though mental illness is widespread in the population, the main burden of illness is concentrated in a much smaller proportion, about 6%, or 1 in 17 Americans, who live with serious mental illness. The National Institute of Mental Health reports that 1 in 4 adults, approximately 57 million Americans, experiences a mental health disorder in a given year. The U.S. General reports that 10% of children and adolescents in the United States suffer from a serious emotional or mental disorder that cause significant functional impairment in their day-to-day lives at home, in school, and with their peers. The World Health Organization has reported that 4 of the 10 leading causes of disability in the U.S. and other developed countries are mental disorders. By 2020, major depressive illness will be the leading cause of disability in the world for women and children. Mental illness usually strikes individuals in the prime of their lives, often during adolescence and young adulthood. All ages are susceptible, but the young and the old are especially vulnerable. Without treatment, the consequences of mental illness for the individual and society are staggering. Unnecessary disability, unemployment, substance abuse, homelessness, inappropriate incarceration, suicide, and wasted lives. The economic cost of untreated mental illness is more than $100 billion each year in the United States. The best treatments for serious mental illness today are highly effective. Between 70 and 90% of individuals have significant reduction of symptoms and improved quality of life with a combination of pharmacological and psychological treatments and supports. with appropriate, effective medication and a wide range of services tailored to their needs. Most people who live with serious mental illnesses can significantly reduce the impact of their illnesses and find a satisfying measure of achievement and independence. A key concept is to develop expertise in developing strategies to manage the illness process. Early identification and treatment is of vital importance. By ensuring access to the treatment and recovery supports that are proven effective, recovery is accelerated and the further harm related to the course of illness is minimized. And finally, stigma erodes confidence that mental disorders are real, treatable health conditions. We have allowed stigma and a now unwarranted sense of hopelessness to erect attitudinal, structural, and financial barriers to effective treatment and recovery. It is time to take these barriers down. Everyone experiences some level of anxiety. However, when feelings of intense fear and distress are overwhelming and prevent us from doing everyday things, an anxiety disorder may be the cause. Anxiety disorders are the most common mental health concern in the United States. An estimated 40 million adults in the U.S., or 18%, have an anxiety disorder. Approximately 8% of children and teenagers experience the negative impact of an anxiety disorder at school and at home. Just like with any mental illness, people with anxiety disorders experience symptoms differently. But for most people, anxiety changes how they function day to day. People can experience one or more of the following symptoms. The first group of symptoms is emotional symptoms, such as feelings of apprehension, dread, worry, fear, feeling tense or jumpy, restlessness, irritability, and finally anticipating the worst and being watchful for signs of danger. At its most severe, this is described as hypervigilance, where the person is constantly alert to identify any dangers in their environment. The physical symptoms of anxiety are pounding or racing of the heart, shortness of breath. Many people report to the emergency room with a fear that they are having a heart attack because of the effects that it has on the heart. Also included are upset stomach, sweating, tremors, twitching, headaches, fatigue, and insomnia. And in addition to the upset stomach, anxiety disorders can also affect the frequency of urination and the working of the bowels, leading to diarrhea. Different anxiety disorders have various symptoms. This also means that each type of anxiety disorder has its own treatment plan. The most common anxiety disorders include panic disorder, which is characterized by panic attacks, sudden feelings of terror, sometimes striking repeatedly and without warning. Often mistaken for a heart attack, a panic attack causes powerful physical symptoms including chest pain, heart palpitations, dizziness, shortness of breath, and stomach upset. Next is phobias. Most people with specific phobias have several triggers. To avoid panicking, someone with specific phobias will work hard to avoid their triggers. Depending on the type and number of triggers, this fear, and the attempt to control it, can seem to take over a person's life. Generalized anxiety disorder produces chronic exaggerated worrying about everyday life. This can consume hours each day, making it hard to concentrate or finish routine daily tasks. A person with generalized anxiety disorder may become exhausted by worry and experience headaches, tension, or nausea. And finally, social anxiety disorder. Unlike shyness, social anxiety disorder causes intense fear, often driven by irrational worries about social humiliation, such as saying something stupid or not knowing what to say. Someone with social anxiety disorder may not participate in conversations, contribute to discussions, or offer any of their ideas, and they may become isolated. Panic attack symptoms are a common reaction. Scientists believe that many factors combine to cause anxiety disorders, including genetics. Some families will have a higher than average number of members experiencing anxiety issues, and studies support the evidence that anxiety disorders run in families. This can be a factor in someone developing an anxiety disorder. Additionally, stress can produce anxiety disorders. A stressful or traumatic situation, such as abuse, death of a loved one, violence, or prolonged illness, is often linked to the development of an anxiety disorder. The physical symptoms of an anxiety disorder can be easily confused with other medical conditions like heart disease or hyperthyroidism. Therefore, a doctor will likely perform a careful evaluation involving a physical examination, an interview, and laboratory work. After ruling out a medical illness, the doctor may recommend a person see a mental health professional to make a diagnosis. As each anxiety disorder has a different set of symptoms, the types of treatment that a mental health professional may suggest also can vary. But there are some common types of treatment that are used. First, there's psychotherapy, including cognitive behavioral therapy. Also, medications, including anti-anxiety medications and antidepressants. And finally, complementary health approaches such as stress management or relaxation techniques are often used in the treatment of anxiety disorders. Depression is more than just feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding and medical care. Left untreated, depression can be devastating for the people who have it and for their families. Fortunately, with early detection, diagnosis, and a treatment plan consisting of medication, psychotherapy, and lifestyle choices, many people do get better. Some people have only one episode in a lifetime, but for most people, depression recurs. Without treatment, episodes may last a few months to several years. An estimated 16 million American adults, almost 7% of the population, had at least one major depressive episode in the past year. People of all ages and all racial, ethnic, and socioeconomic backgrounds experience depression, but it does affect some groups of people more than others. Women are 70% more likely than men to experience depression. And young adults aged 18 to 25 are 60% more likely to have depression than people aged 50 or older. Just like with any mental illness, people with depression experience symptoms differently. But for most people, depression changes how they function day to day. Common symptoms of depression include changes in sleep or appetite, a lack of concentration, a loss of energy, a lack of interest in common activities, low self-esteem, hopelessness, changes in their physical movement, and physical aches and pains. To be diagnosed with depression, a person must have experienced a major depressive episode that has lasted longer than 2 weeks. And again, the diagnostic symptoms of a major depressive episode include loss of interest or loss of pleasure in all activities, change in appetite or weight, sleep disturbances, feeling agitated or feeling slowed down, fatigue, feelings of low self-worth, guilt, or shortcomings, difficulty concentrating or making decisions, and finally, suicidal thoughts or intentions. Depression does not have a single cause. It can be triggered, or it may occur spontaneously without being associated with a life crisis, physical illness, or other risk. Scientists believe several factors contribute to cause depression. The first is trauma. When people experience trauma at an early age, it can cause long-term changes in how their brains respond to fear and stress. These brain changes may explain why people who have a history of childhood trauma are more likely to experience depression. Second is genetics. Mood disorders and risk of suicide tend to run in families, but genetic inheritance is only one factor. Next is life circumstances. Marital status, financial standing, and where a person lives have an effect on whether a person develops depression, but it can be a case of the chicken or the egg. Also included is brain structure. Imaging studies have shown that the frontal lobe of the brain becomes less active when a person is depressed. Depression is also associated with changes in how the pituitary gland and hypothalamus respond to hormone stimulation. Other medical conditions can also cause depression. People who have a history of sleep disturbances, medical illness, chronic pain, anxiety, and attention deficit hyperactivity disorder are more likely to develop depression. And finally, drug and alcohol abuse. Approximately 30% of people with substance use problems also have depression. Although depression can be a devastating illness, it often responds to treatment. The key is to get a specific evaluation and a treatment plan. Treatment can include any one or combination of the following treatments: medications, including antidepressants, mood stabilizers, and sometimes antipsychotic medications; psychotherapy, including cognitive behavioral therapy, family-focused therapy, or interpersonal therapy; light therapy, which uses a light box to expose a person to full-spectrum light, and it helps to regulate the hormone melatonin; exercise, meditation, faith, and prayer have been very helpful for many individuals in treating depression. And then some alternative medical strategies, including acupuncture, nutritional therapy, meditation, and other self-management strategies, have been shown to assist in the treatment of depression. Bipolar disorder is a chronic mental illness that causes dramatic shifts in a person's mood, energy, and ability to think clearly. People with bipolar disorder have high and low moods, known as mania and depression, which differ from the typical ups and downs most people experience. If left untreated, the symptoms usually get worse. However, with a strong lifestyle that includes self-management and a good treatment plan, many people live well with the condition. Although bipolar disorder can occur at any point in life, the average age of onset is 25. Every year, 2.9% of the U.S. population is diagnosed with bipolar disorder, with nearly 83% of the cases being classified as severe. Bipolar disorder affects men and women equally. A person with bipolar disorder may have distinct manic or depressed states. Severe bipolar episodes of mania or depression may also include psychotic symptoms such as hallucinations or delusions. Usually, these psychotic symptoms mirror a person's extreme mood. Mania is an essential component of bipolar disorder. To be diagnosed with bipolar disorder, a person must have experienced mania or hypomania. Hypomania is a milder form of mania that doesn't include psychotic episodes. People with hypomania can often function normally in social situations or at work. Some people with bipolar disorder will have episodes of mania or hypomania many times. Others may experience them only rarely. Although someone with bipolar disorder may find an elevated mood very appealing, especially if it occurs after depression, the high does not stop at a comfortable or controllable level. Moods can rapidly become more irritable, behavior can become more unpredictable, and judgment more impaired. During periods of mania, people frequently behave impulsively, make reckless decisions, and take unusual risks. Most of the time, people in manic states are unaware of the negative consequences of their actions. Depression is also a characteristic of bipolar disorder. Depression produces a combination of physical and emotional symptoms that inhibit a person's ability to function nearly every day for a period of at least 2 weeks. The level of depression can range from severe to moderate to mild low mood, which is called dysthymia when it is chronic. Scientists have not discovered a single cause for bipolar disorder. They believe several factors may contribute. The first is genetics. The chances of developing bipolar disorder are increased if a child's parents or siblings have the disorder, but the role of genetics is not absolute. Stress may also trigger bipolar disorder. A stressful event, such as a death in the family, an illness, a difficult relationship, or financial problems, can trigger the first bipolar episode. In some cases, drug abuse can also trigger bipolar disorder. And finally, brain structure. Brain scans cannot diagnose bipolar disorder in an individual. However, researchers have identified subtle differences in the average size or activation of some brain structures in people with bipolar disorder. While brain structure alone may not cause it, there are some conditions in which damaged brain tissue can predispose the person. Bipolar disorder is a chronic illness, so treatment must be ongoing. If left untreated, the symptoms of bipolar disorder may get worse, so diagnosing it and beginning treatment in the early stages is important. There are several well-established types of treatment for bipolar disorder. First, there are medications, such as mood stabilizers, antipsychotic medications, and antidepressants. In terms of therapy, cognitive behavioral therapy and family-focused therapy have been shown to work particularly well with bipolar disorder. Complementary health approaches such as meditation, faith, and prayer, and self-management strategies have also been shown to be effective in the treatment of bipolar disorder. Schizophrenia is a serious mental illness that interferes with a person's ability to think clearly, manage emotions, make decisions, and relate to others. It is a complex, long-term medical illness affecting about 1% of Americans. Although schizophrenia can occur at any age, the average age of onset tends to be in the late teens to the early 20s for men, and the late 20s to early 30s for women. It is uncommon for schizophrenia to be diagnosed in a person younger than 12 or older than 40. Just like with any mental illness, people with schizophrenia experience symptoms differently. Symptoms may include hallucinations, which can include a person hearing voices, seeing things, or smelling things that others can't perceive. Delusions, which are false beliefs that don't change even when the person who holds them is presented with new ideas or facts. Disorganized thinking, such as struggling to remember things, organize thoughts, or to complete tasks. And finally, negative symptoms such as being emotionally flat or speaking in a dull, disconnected way. Diagnosing schizophrenia is not easy. The difficulty of diagnosing this illness is compounded by the fact that many people who are diagnosed do not believe they have it. Lack of awareness is a common symptom of people diagnosed with schizophrenia and greatly complicates treatment. To be diagnosed with schizophrenia, a person must have 2 or more of the following symptoms occurring persistently in the context of reduced functioning. Those symptoms include delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, or negative symptoms. Research suggests that schizophrenia may have several possible causes. The first is genetics. Schizophrenia isn't caused by just one genetic variation, but a complex interplay of genetics and environmental influences. While schizophrenia occurs in 1% of the general population, having a history of family psychosis greatly increases the risk. Schizophrenia occurs at roughly 10% of people who have a first-degree relative with the disorder, such as a parent or a sibling. Next is environment. Exposure to certain viruses or malnutrition before birth, particularly in the first and second trimesters, has been shown to increase the risk of schizophrenia. Inflammation or autoimmune diseases can also lead to increased immune system impairment, which may lead to schizophrenia. Brain chemistry. Problems with certain brain chemicals, including neurotransmitters called dopamine and glutamate, may contribute to schizophrenia. Neurotransmitters allow brain cells to communicate with each other. Networks of various neurons are likely involved as well. And finally, drug use. Some studies have suggested that taking mind-altering drugs during the teen years and young adulthood can increase the risk of schizophrenia. A growing body of evidence indicates that smoking marijuana increases the risk of psychotic incidents and the risk of ongoing psychotic experience. The younger and more frequent the use, the greater the risk. Another study has found that smoking marijuana led to earlier onset of schizophrenia and often preceded the manifestation of the illness. With medication, psychosocial rehabilitation, and family support, the symptoms of schizophrenia can be reduced. People with schizophrenia should get treatment as soon as the illness starts showing, because early detection can reduce the severity of their symptoms. Treatment options include antipsychotic medications. Typically, a healthcare provider will prescribe antipsychotics to relieve symptoms of psychosis, such as delusions and hallucinations. Due to the lack of awareness of having an illness and the serious side effects of medication used to treat schizophrenia, people who have been prescribed them are often hesitant to take them. Also, psychotherapy can be used. Psychotherapy such as cognitive behavioral therapy or cognitive enhancement therapy have been shown to work with individuals with schizophrenia. And finally, psychosocial treatments. People who engage in therapeutic interventions often see improvement and experience greater mental stability. Psychosocial treatments enable people to compensate for or eliminate the barriers caused by their schizophrenia and learn to live successfully. If a person participates in psychosocial rehabilitation, they are more likely to continue taking their medication and less likely to relapse. Some of the more common psychosocial treatments include assertive community treatment. Obsessive-compulsive disorder, also known as OCD, is characterized by repetitive, unwanted, intrusive thoughts, called obsessions, and irrational, excessive urges to do certain actions, called compulsions. Although people with OCD may know that their thoughts and behavior don't make sense, they are often unable to stop them. Symptoms typically begin during childhood, the teenage years, or young adulthood, although males often develop them at younger age than females. More than 2% of the U.S. population will be diagnosed with OCD during their lives. If a parent or sibling has an obsessive-compulsive disorder, there's close to a 25% chance that another immediate family member will have it. Just like with any mental illness, people with obsessive-compulsive disorder experience symptoms differently. Most people have occasional obsessive thoughts or compulsive behaviors. However, in an obsessive-compulsive disorder, these symptoms generally last more than an hour each day and interfere with the person's daily life. Obsessions are intrusive, irrational thoughts or impulses that repeatedly occur. Compulsions are repetitive acts that temporarily relieve the stress brought on by an obsession. Like obsessions, people may try not to perform compulsive acts, but feel forced to do so to relieve anxiety. Obsessions may also include thoughts about harming or having harmed someone else, doubts about having done something right, like turning off the stove or locking a door, unpleasant sexual images, or fears of saying or shouting inappropriate things in public. Compulsions may include things such as hand washing due to a fear of germs, counting and recounting money because a person can't be sure they added correctly, checking to see if a door is locked or if the stove is off, and other types of mental checking that goes with intrusive thoughts. For many individuals with obsessive-compulsive disorder, a combination of medicine and therapy is superior to either approach alone. While medicine may work directly on the brain, the therapies are believed to help retrain the brain to recognize false threats. The most common type of medications used to treat OCD are antidepressants. Treating OCD with antidepressants often takes longer to take effect than treating depression. Also, these medications must sometimes be given in larger doses and for a longer period of time than for depression. There are two types of therapies that are helpful for treating OCD. The first is exposure and response therapy, called ERT. ERT exposes a person to the cause of their anxiety. For example, a person with a fear of germs may be asked by a doctor or therapist to put their hand on something considered dirty, such as a doorknob. Afterwards, they will refrain from washing their hands. The length of time between touching the doorknob and washing hands becomes longer and longer. Cognitive behavioral therapy is also used. It focuses on the thoughts that are causing the distress and changing the negative thinking and behavior associated with them. For obsessive-compulsive disorder, the goal of this therapy is to recognize negative thoughts and, with practice, gradually lessen their intensity to the point of harmlessness. Traumatic events such as military combat, assault, an accident, or a natural disaster can have long-lasting negative effects. Sometimes our biological responses and instincts, which can be life-saving during a crisis, leave people with ongoing psychological symptoms because they are not integrated into consciousness. PTSD affects about 3.5% of the U.S. adult population, but women are more likely to develop the condition than men. About 37% of those cases are classified as severe. While PTSD can occur at any age, the average age of onset is in a person's early 20s. Recently, there has been an emphasis on trauma-informed care. Trauma-informed care is an approach in the human services field that assumes that an individual is more likely than not to have a history of trauma. Trauma-informed care recognizes the presence of trauma symptoms and acknowledges the role trauma may play in an individual's life, including service staff. On an organizational or systemic level, trauma-informed care changes organizational culture to emphasize respecting and appropriately responding to the effects of trauma at all levels, similar to the change in general protocol regarding universal precautions. Trauma-informed care practices and awareness and becomes almost second nature and pervasive in all service responses. Trauma-informed care requires a system to make a paradigm shift from asking what is wrong with this person to what has happened to this person. The symptoms of PTSD fall into the following categories. Intrusive memories, which can include flashbacks of reliving the moment of trauma, bad dreams, or scary thoughts. Avoidance, which can include staying away from certain places or objects that are reminders of the traumatic event. A person may also feel numb, guilty, worried, or depressed, or have trouble remembering the traumatic event. Dissociation, which can include out-of-body experiences or feeling that the world is not real. And finally, hypervigilance, which can include being startled very easily, feeling tense, trouble sleeping, or outbursts of anger. Symptoms of PTSD usually begin within 3 months after a traumatic event, but occasionally emerge years afterwards. Symptoms must last more than a month to be considered PTSD. PTSD is often accompanied by depression, substance abuse, or another anxiety disorder. Treatment for PTSD usually includes a combination of medications and psychotherapy. There is no one medication that will treat all cases of PTSD. The effective combination of psychotherapy and medication should be used together to reduce its symptoms. Given the common co-occurrence of depression-related anxiety disorders, aggression and impulsivity, selecting medications that address these related problems is recommended. Common categories of medications used include antidepressants, antipsychotics, and mood stabilizers. People with PTSD respond better to select structured interventions than to unstructured supportive psychotherapy. In addition to the following therapies, research is being conducted on dream revision therapy, also known as imagery rehearsal therapy. The strategies currently being used include cognitive behavioral therapy, which helps change the negative thinking and behavior associated with the depression. The goal of this therapy is to recognize negative thoughts and replace them with positive thoughts, which leads to more effective behavior. Eye movement desensitization and reprocessing, also called EMDR, is an eclectic psychotherapy intervention designed for trauma that employs exposure to traumatic memories with alternating stimuli. Eye movements are one of several options in structured sessions with an individual certified to perform EMDR. And finally, exposure therapy helps people safely face what they find frightening so that they can learn to cope with it effectively. For example, virtual reality programs allow a person to experience the situation in which he or she experienced the trauma. Other forms of therapy include service dogs and support groups, and recently many healthcare professionals have begun to include alternative treatments such as yoga, aquatherapy such as floating chambers and surfing, acupuncture, and meditation for the treatment of post-traumatic stress disorder. Borderline personality disorder is a condition characterized by difficulties in regulating emotion. This difficulty leads to severe mood swings, impulsivity and instability, poor self-image, and stormy personal relationships. People may make repeated attempts to avoid real or imagined situations of abandonment. It is ultimately characterized by the emotional turmoil it causes. People who have it feel emotions intensely and for long periods of time, and it is harder for them to return to a stable baseline after an emotionally intense event. Suicide threats and attempts are very common for people with borderline personality disorder. Self-harming acts, such as cutting and burning, are also common. It's estimated that 1.6% of the adult U.S. population has borderline personality disorder, but it may be as high as 5.9%. Nearly 75% of people diagnosed with borderline personality disorder are women, but recent research suggests that men may be almost as frequently affected by the disorder. In the past, men with borderline personality disorder were often misdiagnosed with PTSD or depression. People with borderline personality disorder experience wide mood swings and can display a great sense of instability and insecurity. Signs and symptoms may include frantic efforts to avoid being abandoned by friends and family, unstable personal relationships that alternate between idealization and devaluation. This is also sometimes known as splitting. Distorted and unstable self-image, which affects moods, values, opinions, goals, and relationships. Impulsive behaviors that can have dangerous outcomes, suicidal and self-harming behaviors. Periods of intense depressed mood, irritability, or anxiety lasting a few hours to a few days. Chronic feelings of boredom or emptiness. Inappropriate, intense, or uncontrollable anger, often followed by shame and guilt. And finally, dissociative feelings, disconnecting from the person's thoughts or sense of identity, or out-of-body type of feelings, and stress-related paranoid thoughts. Severe cases of stress can also lead to brief psychotic episodes. There's no single medical test to diagnose borderline personality disorder, and a diagnosis is not based on one sign or symptom. It is diagnosed by a mental health professional following a comprehensive interview that may include talking with previous treatment providers and looking at previous medical evaluations, and when appropriate may include interviews with family and friends. People with borderline personality disorder are often treated with a combination of psychotherapy, peer and family support, and medications to address co-occurring symptoms. Medications are not specifically made to treat the core symptoms of emptiness, abandonment, and identity disturbance, but can be useful in treating other symptoms associated with borderline personality disorder, such as anger, depression, and anxiety. Medications may include mood stabilizers, antipsychotics, antidepressants, and anti-anxiety drugs. Psychotherapy is a cornerstone for treating a person with borderline personality disorder. In addition to dialectical behavior therapy, which was created specifically for the treatment of borderline personality disorder, there are several types of psychotherapy that are effective. These treatments include cognitive behavioral therapy and metallization-based therapy. Dual diagnosis is a term for when someone experiences a mental illness and a substance abuse problem simultaneously. The term co-occurring disorders is also used. Dual diagnosis is a very broad category. It can range from someone developing mild depression because of binge drinking to someone's symptoms of bipolar disorder becoming more severe when that person abuses heroin during periods of mania. Either substance abuse or mental illness can develop first. A person experiencing a mental health condition may turn to drugs and alcohol as a form of self-medication to improve the troubling mental health symptoms they experience. However, research shows that drugs and alcohol only make the symptoms of the mental health condition worse. Abusing substances can also lead to mental health problems because of the effects drugs have on a person's moods, thoughts, brain chemistry, and behavior. About a third of all people experiencing mental illnesses and about half of the people living with severe mental illnesses also experience substance abuse. These statistics are mirrored in the substance abuse community, where about a third of all alcohol abusers and more than half of all drug abusers report experiencing a mental illness. Men are more likely to develop a co-occurring disorder than women. Other people who have a particularly high risk of dual diagnosis include individuals of lower socioeconomic status, military veterans, and people with more general medical illnesses. The defining characteristic of dual diagnosis is that both a mental health and substance abuse disorder occur simultaneously. Because there are many combinations of disorders that can occur, the symptoms of dual diagnosis vary widely. The symptoms of substance abuse may include withdrawal from family and friends, sudden changes in behavior, using substances under dangerous conditions, engaging in risky behaviors when drunk or high, loss of control over the use of the substance, doing things a person wouldn't normally do to maintain their habit, developing tolerance and withdrawal symptoms, and finally feeling like the person needs the drug to be able to function normally. The symptoms of a mental health condition also can vary widely. Knowing the warning signs, such as extreme mood changes, confused thinking, or problems concentrating, avoiding friends and social activities, and thoughts of suicide can help identify if there is a reason to seek help. The most common method of treatment for dual diagnosis today is integrated intervention, where a person receives care for both a specific mental illness and substance use. Because there are many ways in which a dual diagnosis may occur, treatment will not be the same for everyone. Several types of treatment include detoxification. The first major hurdle that a person with dual diagnosis will have to pass is detoxification. During inpatient detoxification, a person is monitored 24/7 by a trained medical staff for up to 7 days. Inpatient detoxification is generally more effective than outpatient for initial sobriety. This is because inpatient treatment provides a consistent environment and removes the person battling addiction from exposure to people and places associated with using. Also, inpatient and outpatient substance abuse treatment is used. A person experiencing a serious mental illness and dangerous or dependent patterns of substance use may benefit most from an inpatient treatment center where he or she can receive concentrated medical and mental health care. These treatment centers provide the person with therapy, support, medication, and health services with the goal of treating the addiction and its underlying causes. Supportive housing like group homes or sober houses is another type of residential treatment center that is most helpful for people who are newly sober or are trying to avoid relapse. Medications are a useful tool for treating a variety of mental illnesses. Depending on the mental health symptoms a person is experiencing, different mental health medications may play an important role in one's recovery. Certain medications are also helpful for people experiencing substance abuse. These medications are used to help ease withdrawal symptoms or to promote recovery. Medications to ease withdrawal are used during the detoxification process. Psychotherapy is almost always a part of an effective dual diagnosis treatment plan. Education on a person's illness and how their beliefs and behaviors influences their thoughts has been shown in countless studies to improve the symptoms of both mental illness and substance abuse. Cognitive behavior therapy in particular is effective in helping people with dual diagnosis learn how to cope and to change ineffective patterns of thinking. And finally, dealing with dual diagnosis can feel challenging and isolating. Support groups allow members to share their frustrations, their successes, their referrals to specialists, where to find the best community resources, and tips on what works best when trying to recover. They also help form friendships and provide encouragement to stay clean.